Hi, everyone, and welcome to episode 140 of the Veterinary Behaviour Chat podcast. And today we have another 15-minute speed coaching session. And I'll explain the rules of the game in a little bit, but we're being joined by the wonderful Sharon Jones, who is a trainer. Well, I'm going to get her to introduce herself in a second and let everyone know what she does, because she's got a very specific niche, which is very exciting. But the rules of the game of the 15-minute speed coaching episodes are that Sharon's going to ask me a question, something that she wants to kind of chat through. We are then going to hit the timer, and we've got exactly 15 minutes to chat through the question at hand. We'll try not to go over 15 minutes. So literally the moment the bell goes, that's it. Sometimes that might leave us on a bit of a cliffhanger. So sometimes we don't get through all the questions, but most of the time we get to a pretty good resolution. So that's what this episode is going to look like. So welcome, Sharon. So lovely to have you here.
Hello. Thank you.
Pleasure. Yeah. Give us a bit of an overview of who you are, what you do, and how you come to the canine behaviour world.
Yeah, so I'm based in Warrington in Cheshire in the UK, and I came to the behaviour world because of my own dog, Chester, who's a miniature schnauzer. He's now 8, but when he was very, very young as a puppy, he was really reactive. I took him on when he was 7 months old. I rehomed him, and he was a reactive dog, and I got lost in the world of trying to help him and got very frustrated and upset at times because we took a step forward and 2 steps back. And so in the end, I just decided to study the subject myself, and I did a massive deep dive into particularly the reactivity side of dog training and behaviour, and when I spent hundreds and thousands of hours and thousands of pounds on my training over the years. And so started to work with dogs a couple of years after that into my training, and initially all different types of breeds and all different types of struggles, from some working through reactivity, but also puppy training and dogs that struggle with visitors, etc. And then kind of like kept finding I was being referred miniature schnauzers because I have one and I'm in that world. So about a year ago, I decided to niche completely, and now I am the schnauzer trainer. and I train people all over the world, which I still have to pinch myself. I've got clients all over the world, literally, and it's fab. And quite a lot of it's remote training, obviously, for that reason. I do still do a bit of in-person, and a big amount of my offering is remote now as well, so it works really, really well.
That's incredible. And I think that the idea of niching is something that's become, I guess, a little bit more not popular, but it's something that many trainers are looking into, because I think you just feel that you can offer more bespoke services, and that, like you say, that deep dive into certain breeds or certain problems that we face with particular breeds, maybe more so than others. So yeah, I love that. It's very cool.
Yeah, and it helps the caregivers, guardians of these dogs know that somebody really understands them.
Yeah.
And I think that's a big piece. Yeah.
Absolutely. Brilliant. All right. We are going to move on to the question. So I am going to hit the timer. And as soon as I've hit the timer, you can go ahead. Oh, hang on. We're on 2 minutes, 55 seconds. That wouldn't be good.
That wouldn't be long enough.
No, that wouldn't be long enough. Here we go. All right. You ready?
Yep, I'm ready.
All right, hitting start, and we're off.
Okay. So working with dogs who struggle with car journeys is the bit that I'd like to unpick today. So I've worked with some dogs who struggle kind of with the slowing down and speeding up part of a journey, or turning right and turning left. I've worked with dogs who I think have had an experience, perhaps have been sick as a puppy, and they have that memory of that experience. And I think there's some anticipatory issues around where they're going. Perhaps they've had a not very nice vet visit or grooming visit or blah, blah, blah. So, and also I'm aware as well that there may be some balance or vestibular type issues around the motion and the movement within the car. So in terms of unpicking it, like to go in from the beginning, working with a dog who's got car struggles, I'd really love to ask you how you start the process of unpicking it to then know where to go with it.
Yeah. It's such a great question, and it's not an easy one to resolve, is it? Because of all of the things that you've just mentioned, it can be very much multifactorial, and also, some of the things can kind of stack on top of each other. So they could be motion, have motion sickness, and also be fearful. So it's not maybe just one thing, but yeah, it's definitely one that is a challenging one, but it's such an important one because obviously car journeys are kind of part of our sort of a little emergency care package, right? If we need to take an urgent trip to the veterinary clinic, we want to make sure, for example, that is something that our dogs can handle. So I think in terms of unpicking it, obviously I would always think physical health first. So for me, the first thing I look at is there any sign of nausea? Is there any sign of motion sickness? And sometimes there can be kind of telltale giveaway signs, right? If the dogs are hypersalivating or if they actually do vomit. I think those absolutely can be signs that point us towards that sort of direction. But sometimes there also aren't any signs, right? The dogs might be feeling sick and you wouldn't maybe notice outwardly. Sometimes they can lip lick. So there might be some subtle signs of that. And I think one of the first things that I often do in that whole process is actually trial some antiemetics, so some anti-nausea medications.
Okay.
Because that's kind of it's a big piece of the puzzle potentially. I think it's important to say that there are a couple of different anti-nausea medications, and sometimes you have to trial a couple. Some dogs respond to some and not others. So the one I would usually start with is meropenem, which the brand name there is Serenia. It's a tablet that you can give, but you have to use a specific dose for car travel. And it's actually the manufacturer sort of like it's written on the packet, if you like, but there is a license for car travel specifically, and you have to give quite a high dose. I think something like 8 milligrams per kilogram for car travel, as opposed to using it maybe within clinic for a dog that's nauseous, for other reasons.
Okay.
Ondansetron would be another one. We have to be a little bit careful with that one because that does have some serotonergic activity, but that is probably always my first kind of piece of the puzzle. I would then, a little bit on that same vein, secondarily look at, do we have any other signs of physical discomfort? Do we have chronic pain? And I think you're right, what you said about the movement of the car, and maybe if the dog isn't stabilized in the car and they're sort of slipping around and they start to feel a little bit vulnerable, especially if they're painful. So that would be something else that I would consider. So that's my first block, is looking at physical health pieces that we need to maybe consider or address.
Okay. And then in terms of them, so if it was a physical health struggle, obviously understanding that, diagnosing that and treating that is a way forward. And then in terms of keeping a dog more stable in a car, there is obviously a crate, which is one option. And there's these sort of bolster beds that have these sides to them. Is there anything else that you're aware of in terms of creating more stability for a dog who is struggling with the movement and motion side of it?
Yeah, and again, that can be difficult. So of course, harnesses. So you can get harnesses that you can kind of clip a seatbelt onto. I quite like those bolster seats because they tend to provide a bit more stability. I've seen dogs that have had kind of harnesses and with a seatbelt clipped onto it, especially if it's a leather seat car, right? They could still slip around, and then they're almost like impinged a little bit by the seatbelt. Crates, as long as the dog is tolerant of a crate. But then we have to think about, how big is that crate and what would be the movement within that crate, especially if it does have like a plastic floor. Again, that might cause some kind of slipping around. So getting something where the dog can actually feel secure, I think, is really important. And here's one interesting fact that relates a little bit to that. So we discuss about this quite regularly in the American College listserv. So we've got a listserv where all the diplomats are part of, and car travel is actually something that is discussed quite frequently because, as you say, it's quite a common problem. And some of my colleagues in the US, they've actually used accelerometers in different parts of the car to see whether there are seats or places within the car that might be more or less, I guess, movement sensitive, or where the dog might experience more or less movement. So they found some really interesting things, for example, that, you know, a particular seat in the front of, in the kind of the back seat of the car, a particular place there showed up a lot less of this sort of accelerometry.
Okay. Well, that's really interesting. Okay.
Yeah.
Okay, that's really, really interesting. Okay, because it occurred to me as well, like, you know, if a dog was like a puppy farm dog, for instance, they might, their first experience of being in a vehicle might be to go in a van on a ferry over from Ireland to the UK, or for instance, and that's their, you know, this massive long journey is their first experience of a vehicle, and that has to have implications, doesn't it, as opposed to a, you know, an ethical breeder who has put the puppies in the car and done these little, you know, round the block trips, little frequent trips, and got them used to this kind of motion and movement. So motion and movement probably is quite a big thing, and that's actually really interesting, as well as having some sort of shock absorbing kind of surface for the dog to be on, so they're not slipping and sliding and moving around so much. Yeah.
And I think really importantly, with both the things that we've mentioned, so both kind of nausea and pain, or, you know, discomfort, as well as, you know, the instability or the vulnerability that they might experience from the motion, there's a learned component to that, right? So if a dog has learned that when they go in the car, they might feel sick, even if we've taken away the nausea for this particular trip, it can be really tricky to undo that learning piece. And I think that's why some of these issues also can be challenging, because our brain prioritizes learning to do with safety, security, and avoidance of threat. And if our brain has learned that going in the car can potentially be physiologically threatening, either because there's nausea or because there's pain, it is going to recall that fear memory really quickly. And it's something that we've been talking about a lot also sort of in the pain space. You know, just because we're addressing pain by maybe giving pain meds, or in this case anti-nausea meds, that doesn't necessarily mean that it immediately stops, you know, the stress behaviors linked with that because of that fear learning. So I think that's, from your perspective, I think that's a really interesting piece, because, you know, you can go a long way to help with the counter conditioning of that emotional experience, I think, from a training point of view. But I think that's important for anyone to remember. Just because we're addressing some of these things, or even, you know, if we do then put the dog in a more stable kind of seat or harness, you know, we take away the slippy floors, we maybe see which seat in the car has the least kind of motion effect. We still have to address the unlearning of it.
Yeah, so what I've tried to do for that is to, you know, like a balance path type thing, have objects for the dog to walk over and climb over, and initially make them stable, but then as time moves on, session by session, start to create a little bit of instability there, that sort of thing. So there's some new learning around motion and movement going on. So that's something I put in to help with layering some new learning on top of that.
Yeah, no, that's great. And I think, you know, all of those things are going to be important. And yes, we can desensitize to the car, you know, that kind of systematic process of, you know, showing the car, getting in the car, getting out of the car, getting in the car, doing short journeys, all of those things can be strategies. But I think we're finding more and more that whole desensitization process to things can be really tricky to do, because we have to read the dog so well, otherwise we risk sensitization instead of desensitization. And also it can be really difficult to desensitize to all of the experience that the dog has within that car, right? Whether it's getting in, where it sits, all those sort of things can be really challenging. So yeah, it's definitely not an easy one. And then, of course, I wouldn't be me if I didn't suggest there might be some medications that we could use. And I think all of the short acting or the event medications might be options here. And we would choose, you know, whichever one is most appropriate for the patient. I think, again, when we've been discussing this in the American College listserv, one of the or two medications keep coming up time and again. One of them would be Cilio, which is dexmedetomidine, the oral transmucosal gel. And the other one, interestingly enough, is a benzodiazepine. So because oftentimes dog can truly experience extreme fear or panic in the car, and that's where benzos are good. However, this is the big kind of challenge with this piece is, let's say you're putting the dog in the car to drive them to the park, but you've given them a medication that might have a sedative component. Dog then gets to the park and is almost a little bit too sedate or too affected by the medication to then truly enjoy their walk.
Okay.
So those things are fine if we're going on a long car journey because we're going on holiday, we're trying to get to a different destination. But if we're using it for an everyday basis, driving them to the park, that has some challenges in itself.
Yeah, and I can imagine that's useful for like a car journey to the vet practice or a car journey to the groomers. But people don't want the dog to be sedated necessarily for a walk in the park. So that, I suppose there's this thing about anticipatory struggles in the car as well, about where they're going, and lots of people will report the dog's absolutely fine on the journey. It's when they stop and get somewhere, and then they get a lot of reactivity to get out the car at that point. So it's unpicking, is that an anxiety-led reactivity? Is that an excitement-led reactivity? Is it a combination of both? Is it frustration because the delay element? There's quite a bit of unpicking to do there. And I just kind of thought, what would be your thought process in unpicking that and any medication that might be related to that?
So I would always be led by body language, signs and context, right? So if we have a dog that is getting increasingly worried on the journey itself, I would be wondering whether it's something to do with the motion or the journey itself. If it's really clear that you get somewhere and then you have this kind of sort of heightened behavior, I think it's much more likely to be frustration or excitement, right? Because I think that fear element is over.
Yeah.
One would have thought so, right? So that would be a little bit more likely for me. And if we're thinking about if it's excitement, then I think we need to manage it. We maybe use distraction when we are approaching wherever it is that we're going. If that's a possibility, sometimes you need two people in the car for that, but to kind of break down that cycle of getting there and then like, wow, oh my God, we're here. So can we distract? Can we do some other kind of games in the car as we approach our final destination? If it's frustration, that again becomes tricky. And then we need to address the bigger picture of, how do we help the dog to tolerate frustration overall better in its life, not just on
out of the situation. Exactly. Absolutely. To go down that route. I have actually done a bit of free work as well, kind of in around the car, in the car, around the car. And that seems to have helped create a more positive association, a more calming kind of association with the car as well for some dogs. So that's been quite a nice little interjection. And I think the ones I've struggled with are the ones who like really go when they get there. They've been the hardest ones to work with.
So for those, it's working out what is it, like what's driving behavior. Is it excitement? Is it frustration? What is it? And how can we somehow interject before we get to that point of getting there? Because once you're there and the behavior is there and the emotional arousal is there and the neurobiochemistry is kicked off, it's hard to then backtrack on that. So it's almost being a little bit more preemptive about it and seeing what we can put in place. That's the timer.
I was just going to ask another one, but
So interesting though, just as we're on this note, so I did all my residency research on air travel. Now, obviously air travel is air travel, and there are other things that go into that. But some of the sort of strategies that we use for air travel can be really helpful for car travel as well. And that might include things such as pheromones and maybe supplements and other bits and bobs. So what I'm going to do is I'm going to link, I wrote a really nice review paper together with my mentor, Dr. DePorter, on managing stress during air travel in cats. Now, it is a cat specific paper, but you can absolutely extrapolate the kind of approach that we used for cats to dogs. And there's quite a lot in there as well that sort of talks a little bit about also, crate familiarization. So if you do want to use a crate or a seat or something in the car to help stabilize that movement piece, making sure that that's all in place. So there's quite a few different approaches in there. So I'll definitely link the paper in the show notes. It's open access, so anyone can access the paper, but that might give a little bit more of an insight on how I would think about approaching travel as a big picture thing. But again, it's slightly different, right? Because during air travel, it's that whole thing again about getting from place A to place B, and they're usually longer journeys. Whereas car journeys, it's often that trip to the park, and then, like you say, that's where that anticipatory piece comes in.
No, that's brilliant. Thank you very much. That's really useful. Thank you.
I hope that's been useful. It's such an interesting topic, isn't it? And it is. And I think, like you say, though, just to kind of round it all up again, obviously prevention is always the best strategy. So if you are a breeder, or if you have got a young puppy, taking things slowly and really being mindful about how you acclimatize them. If you do know that you're picking your puppy up from somewhere and you're going to have a long car journey back, maybe it could be worth thinking about the nausea element of that and how we might counteract that in a puppy, maybe with some meds, maybe by not feeding them immediately before the car journey, and also using something like an adaptable puppy collar on puppy's first car journey. So, it's, again, if we can create that positive association with the car at a really young age, whilst they're hopefully in their socialization period, that obviously is the ideal way to go.
And then just kind of having them with you in the back as well, and just you can really keep an eye on them then, can't you, and stop if you need to, and do short stints of journeys, monitoring them as you go. So I totally agree. Prevention is important. Absolutely.
And you can even hold them, cuddle them, make sure you're providing that stability to that motion in the car. There's absolutely nothing wrong with that. So just be having a bit of forward thinking around, what is my puppy's first car journey going to look like? And we want it to be the best possible experience they can have.
Absolutely. And that, create new learning that's a positive learning right from the beginning. Absolutely. That's brilliant. Thank you. Appreciate
my pleasure. I hope that's been useful. And I'll link the paper in the show notes. And I hope everyone listening has found this useful. And I will see everybody next week for episode 141. Bye for now. Thanks, Sharon.
Thank you.